Mr. Jones, how are you today? I'm Tammy, I'm gonna be your nurse. I got an order from the physician that we need to start an IV and give you some medications. I'm gonna wash my hands here. I need to verify your name and date of birth. Can I see your name, Ann? What's that? Oh, you have some laryngitis. Well, that's terrible. We won't expect you to say very much. So I'm gonna gather my supplies over here and get everything all set up so we can put an IV in you. I'm wondering, do you have any medication allergies or any allergies I need to know about? All right, I'm gonna put this side rail down here. All right, let me get all my supplies set up on my table here. Yeah, I have quite a few. All right, I'm gonna open up my extension tubing here. Flush on that. Pull back to break the seal. And we are going to prime our tubing with water. It's all ready to go. And loosen our cap. So a little easier to get to it. All our stuff set up. Here I'm going to move my hand hygiene stuff out of the way here. All right, let me take a peek at your arm here. I'm going to put this tourniquet on here. I want to see where there's a good spot to poke you at. Yep, that spot looks perfect. I'll let that loose here. All right, we're going to clean your site here for 30 seconds. And we're going to let that dry. In the meantime, I'm going to put some gloves on. I'll loosen that up there. All right, we're going to put your tourniquet back on. Nice and tight. All right. Level up, and you're going to feel a poke here. We're going to go in about 35 to 10 degrees. And I got blood flash, so we'll lower down and advance slightly. And then move the hub in. I'll let go of your tourniquet there. Flush ready. All right. Ready? We're going to flush with 3 to 5 milliliters, and we're going to put your dressing up here. Now maybe we can get this off. All right, put that in the garbage. We're going to label your IV. On the side. Let's see, today's the 20th. All right, put that on. Tape over it to make it secure. Won't fall out. You can take this off since I already flushed it. Throw that away too. Alright, oops. Sticky tape, sticky glue. Alright, let's put this in the sharps container so nobody falls in. Alright, now we have your IV in. Ready. Now, probably should hook you up to some IV fluids here. I'm going to turn on your pump. So you are a new patient and you are in the med surg area. And that. I'm going to open up your pump here and slide this in. All right, got that in. We are going to select channel A, and the doctor wants you to have your fluids at 100 milliliters an hour. We got about 200 in that bag. All right, I'll undo the roller clamp here. We'll alcohol this off for 30 seconds. We'll hook you up. All right, put that out of the way. Probably better label our tubing. One. All right, so label our tubing, our bag. All right, and then we'll hit start, and our pump should give us a green light, and we are running. All right, we'll finish cleaning up our supplies here. Document all that. We'll take that off. Okay. We'll remove my gloves and wash my hands. Okay, Mr. Jones, I need to verify your name and date of birth again. All right. And can you tell me, are you allergic to anything? All right, well, I'm going to verify your order. The doctor here has ordered for you to get a steroid medication. So we're going to verify the 8 rights of patient medication administration, the right patient, the right medication, the right route, the right dose, the right time, the right reason, the right response, and the right documentation. So since we have all that done, we're going to check to see what we have running, which looks compatible with my medication because I've checked on that. And then also I'm going to take a look at your IV site. It doesn't look like it's infiltrated or has any redness. So we are going to do hand hygiene. And I'm going to put some more gloves on so I don't get the medication all over my hands. All right, so we're going to get all of our stuff set up here. Flip the seal. And since my top was open, I'm going to alcohol this off for 30 seconds. And I'm going to pull the amount of air, which I'm giving you 1 milliliter. Add it in here. Push the air in and pull out my fluids. We have just enough. Making sure I get out all my air bubbles. The other thing I probably better do is see what you have running. Yep, your medication should be compatible with this. So we're going to find the port closest to you, and we're going to alcohol this off for 30 seconds. And we are going to give the medication over the prescribed amount of time. And we are going to alcohol again and flush with 3 to 5 milliliters. Get the air out of here. All right, here's that. All done with that. Are you feeling okay, Mr. Jones? That's good. Pick up all that. So the one other order that I verified from the physician is that he has an antibiotic that he wants you to start, and this is a secondary medication. So I need to verify your name and date of birth again, and I need to verify your allergies. Do you have any? And then I also need to verify the 8 medication rights, which is the right patient, the right medication, the right time, the right route, the right dose, the right documentation, the right reason, and the right response. Another thing we want to do is see what you have running. Since you have some normal saline here, I checked and our medication, our antibiotic is compatible with that. And the other thing I want to look at is, yep, your site looks good. Doesn't look like it's infiltrated. Maybe I'll throw some gloves on here. I don't want to put this medication on myself. All right, so we're going to open up our secondary line. All right, and since we're using the Solaris pump, we need to hang your primary bag lower than your secondary. So that's the one that goes in. Put that down there. Now, we better prime your IV tubing because it has only air in it at this point. So we're going to find our port here. Oops, oops. Oh, we'll just leave that there for now. And we're going to alcohol this off for 30 seconds. And I probably better do this roller clamp so I don't make a giant mess everywhere. Undo this and hook this up above the pump setting. Now, we're going to loosen the lid just a little bit and prime the tubing. We're going to fill our drip chamber about half full. All right, we're going to roller clamp this. And then we're going to take our antibiotic. We're going to open the bag. We are very carefully going to spike this so not to contaminate it. And we're going to hang this up here, higher than our primary fluid, and undo our roller clamp so the medication goes in. Now, we need to set our pump to have the second medication go in. So I'm going to press channel select and secondary. And this medication is 50 milliliters and it needs to run over an hour, so we'll program it for 50. And we have 50 in our bag, and then we will hit start. And we'll make sure it's dripping. Verify it drips. Good. All right, looks perfect. And let's see, we'll put you back together here. And we'll put your side rail up and your bed down. Pick up all my stuff. All right, looks good. Is there anything else I can get for you right now? All right, you have a nice day, Mr. Jones. Thanks.